Hello everyone, welcome to my channel. Today's topic is again from medical surgical nursing. It is conjunctivitis. Let's begin the video. It is also known as pink eye disease because the sufferers of conjunctivitis get pink colored eye because of the infection. Let's move ahead with the video. This is a diagram for conjunctivitis. In this diagram, the eye looks somehow like pink. It looks pink because the blood is released from the blood vessels and the blood is stored in the sclera. Introduction to conjunctivitis. Conjunctivitis can be defined as infection and inflammation of conjunctiva due to bacterial, viral, and allergic causes. Conjunctiva, explaining about conjunctiva, it is a thin, translucent, elastic tissue layered with bulbar and palpable portions. Bulbar conjunctiva layers the outer part of eyelids between sclera and cornea, where palpable conjunctiva is located at the inside part of the eyelids. So both bulbar and palpable part is located near to each other. Classification of conjunctivitis. It can be classified in many ways, but the most specific classification can be infectious and non-infectious because conjunctivitis is caused by bacteria, virus, and also because of allergic or toxin particles. Infectious conjunctivitis can be divided into viral and bacterial, and non-infectious can be divided into allergic, toxin, chemical, foreign body, and neoplasm conjunctivitis. Because of neoplasm also, people can suffer from conjunctivitis. About the types, we further will explain features of each type of conjunctivitis. This is just the introduction part. Prevalence of conjunctivitis. Bacterial conjunctivitis is mostly seen in pediatric patients, while viral is seen more in adult patients. Talking about viral conjunctivitis, I just said that there will be an explanation of each type, each causative agent type. So viral is the most common cause for conjunctivitis, commonly found. It is also found as an epidemic in some places, some geographical areas. And the most common viral cause is adenovirus. This occurs in community epidemics, as I said, also can occur in school, workplace, and offices. Mode of transmission can be contaminated finger, medical instrument, and swimming pool water. Bacterial conjunctivitis is now commonly seen in children. Causative agent can be chlamydia trachomatis, Neisseria gonorrhoeae, and Haemophilus influenza. Causative agent in adult can be Staphylococcus aureus. Specifically in children, chlamydia, Neisseria, and Haemophilus can be the cause, whereas in adult, Staphylococcus can be the cause. In allergic conjunctivitis, it is commonly seen in summer season and late spring season. Also called as rhinoconjunctivitis, which is hay fever. Features seen in allergic conjunctivitis is irritation in eye, redness, watery discharge, rhinorrhea, and congestion. There is a comparison between LDI and eye suffered from conjunctivitis. LDI looks somehow like this first diagram. Second diagram is of bacterial conjunctivitis. In bacterial conjunctivitis, there is production of discharge. That discharge comes out of the eye through eyelids. In viral conjunctivitis, there is production of tears, as you can see, third diagram, viral conjunctivitis. And in allergic conjunctivitis also, there is production of tears. Risk factor for conjunctivitis can be exposure to foreign body or allergen, close contact to someone infected with conjunctivitis, and use of contact eye lens frequently. So if there is sudden exposure to any foreign body, then conjunctivitis can occur because of that foreign body. Close contact, direct contact with someone who is infected, using the clothes, using the bedding of that person might also cause conjunctivitis. Use of contact eye lens frequently. The contact eye lens that people use, that can also contain bacterial or viral particles. Etiology can be virus, bacteria, allergens, foreign body, or blocked tear duct in newborn. Virus, bacteria, and allergens are already explained. If there is any foreign particle in the eye, that can also cause somehow toxic reaction, which can lead to conjunctivitis. Next is blocked tear duct. Newborn sometimes might contain blocked tear duct. Their tear duct is blocked. That's why, due to increase in pressure inside the eye, due to that block, conjunctivitis can occur in newborn. It can be treated by the help of antibiotics. Pathophysiology of conjunctivitis. First of all, microbes enter the eye when the body comes in contact with infected object or infected person. After that, there is inflammation and irritation of eye. Inflammation because of growth of the microorganism, growth and multiplication. Irritation because that particle causes itchiness, itchy kind of feeling in the eye. After that, there is dilation of blood vessels of the eye. Blood vessels become relaxed. Because of that, as a consequence of that, there can be swelling, redness, exudates, and discharge. Clinical features are pain and irritation in the eye, redness in one or both eye, that is called as hyperemia, itchiness in eye along with discharge. The discharge forms a coat during night that may prevent eye opening in the morning. The discharge that we could see in the previous diagram, this discharge forms a coat during night, because of which after waking up for some time, the person might not be able to open the eye easily. Next is photophobia, that is sensitivity to light. Fever, sore throat, running nose because of the infectious organisms. They move from eye to other surrounding organs. Next is dropping of upper eyelid due to excess discharge and excess production. Eyelid becomes heavier than the normal and there is dropping of upper eyelid. Next is a gritty feeling in one or both eyes. The person who is suffered feels like something is there inside their eye, gritty feeling in one or both eye. Diagnostic test for these can be, first of all, history taking, occupation, a recent infection, and exposure to allergen should be asked while history taking. The discharge can be taken for culture and sensitivity test so that we can find out the nature of microorganism and follow up for same culture and sensitivity test while the person is going for treatment. While the treatment is going on, still follow up culture and sensitivity tests should be done because the amount of microorganism in the product inside the body should be determined in each follow-up. Preventive management of conjunctivitis can be, first of all, mode of transmission should be controlled because it can be easily transmitted from one person to another person through direct contact. So airborne contact and contact that direct contact transmission can be controlled. Next is good hygiene practice should be adopted, like avoid touching of eye with dirty hands, washing of eye once a day, washing eyes with clean water, use of clean towel and separate towel, washing the clothes daily. Hygiene practice includes all this, and washing the clothes daily means washing the important clothes daily, like pillow covers, like towels. If someone is infected from the family, then they should follow strict hygiene practice. The clothing that the patient is using should be washed daily. And even if not that, we should always follow avoid touching of eyes with dirty hands, washing of eyes once a day with the clean water. These things should be followed. Next is pillow covers can be changed on a daily basis. Even if the person is infected or non-infected, pillow covers can be changed on a daily basis so that transmission of organisms can be controlled. And then while the person is under treatment or the person is having symptoms, then use of eye cosmetics should be avoided because eye cosmetic can be toxic when eye is already suffering from infection. The infection can be aggravated. Children suffering from conjunctivitis, we discussed about this previously. Children suffer mostly from bacterial conjunctivitis. They should take a rest for a few days while the treatment is going on, and they should take a leave from school so that transmission to other children in the school can be prevented. Family members should also prevent by proper hand washing, timely hand washing, using separate personal items like towel, handkerchief, and regular medicine. Whatever antibiotic the doctor has given, a complete therapy should be taken. Medical management can be, first of all, for bacterial conjunctivitis, antibiotic eye drops or eye ointment can be provided. These ointments are prescribed especially for infants. Infant, we talked about blocked tear in infant, blocked tear duct. Same antibiotic eye drop or eye ointment. Eye ointment especially is used for newborn and infant. The ointment might blur vision for a few minutes. Just after application, that might blur the vision, but infection gets treated with that ointment. For viral conjunctivitis, it often begins with one eye and spread to another eye as virus takes time to multiply. So, antiviral medicine can be taken. Antiviral medicine can be taken orally, even if it is both for children or for adults. Next is allergic conjunctivitis. To relieve from allergic irritation, anti-allergic drug should be taken. Anti-allergic drug like antihistamines or steroids can be taken. They can relieve the symptoms of allergy in the body. So, anti-allergic medicine can be given, but also patient can avoid the contact with allergen. Just after allergic reaction starts, patient can just shift away, move away from the object that the person is allergic to. Next is nursing management. Nurses can mostly prevent. Nurses have a role in preventing, also treating, but mostly preventing because this is a preventable disease. So providing health education, health teaching about prevention of transmission should be done by nurses. That health teaching should contain topics like timely hand washing, maintaining body hygiene, using separate clothes, and changing pillow covers almost every day. And for those who are infected, proper hygiene should be maintained. Family should be instructed about preventing spread of transmission. Nurses should instruct to discard old contact lenses and use new one after the infection has resolved. If the person is a regular user of contact lenses, then the person should discard the old lens and use a new one. Patient should be instructed not to apply any cosmetic products on eye while symptoms of conjunctivitis are present and treatment is going on. Because cosmetic, as I said, can aggravate the infection. Thank you so much for watching. Next note will be in the next video.